All right. So this day of surgery, it's a long process getting here, but I am an ER doctor, so I've always been told that the only back surgery you don't need is the first one. And obviously, I've watched tons of YouTube videos. The majority of them are very frightening. But I've come to this point where I really don't have the quality of life. And the biggest thing, there's a few things. The biggest thing is neurogenic claudication. That's just a fancy word for, you normally think of claudication as a lack of blood supply. So people that have peripheral vascular disease have it when they walk. But I have it because of the nerve compression at L4 and L5, where I have a Pars defect. I also have a disc injury at L5S1. So the plan as of right now is a 2-level PLIF, the posterior Lumbar Interbody Fusion. And I've probably been miserable since 2018. So it's been 6 years. So the neurogenic claudication, and it's a dull ache that almost never goes away, but it's extremely bad after walking about a half a mile or standing up for more than a few minutes. That's the primary symptom, but then I do have a painful numbness on my left, because that's my right hip. My left medial calf is numb, but it's painful. It's very odd. My left lateral calf has been numb for years, really since the end of my first year of med school is when I was doing squats, and I thought I knew it all and just had a tiny herniated disc. I did not know at the time I had a Pars defect. So that was in the mid 90s. And the other thing that I left out, so I had it kind of mapped out. My right foot, second and third toes have been numb. It goes on the plantar surface, so on the bottom of my foot on the right, and my left foot is not as numb. Every once in a while I'll feel some in there, but mainly it's my right foot. And the time that I can tell it's when I wear flip-flops. That's when I first noticed it. I'm like, ooh, that's weird. And that was in 2018, right before I deployed for I was gone almost the entire year that year. So I didn't have any time to investigate that. But the other symptom that I left out was I had right-sided kidney pain. So it was right at the costovertebral angle on the right, which is where your ribs come out of your spinal column. And so I thought I had a kidney stone, and I ended up getting a kidney stone CT protocol. It was that bad, and it wasn't. And so there was no diagnosis, but now I think I figured out my back is in such constant spasm that it's pulling on my lower rib. So lower rib. Yeah. So I'm having such a spasm in my right side of my low back that it's pulling on my right lower posterior rib. So, and I've just got, like, I can touch it and it's painful right where my ribs intersect. So it's like a combination of the iliopsoas, and the back muscles are several layers and complicated in that area. But when I get that release from the massage therapist, a lot of times I get a complete day without that pain. And then my sleep is terrible. So I basically just roll and roll and roll and roll, because I'll wake up, my entire right leg will be numb no matter what position I'm in. And I used to be able to lay flat on my back with a pillow under my knees and keep that from happening. But the last year and a half or so, even that, I still wake up and my leg's completely numb. So then I have to wake up and stand up and go to the bathroom or something, and for the sensation to come back, and then I can fall back to sleep, and then it'll go numb 40 minutes later or so. And I switch positions, and sometimes that'll help. So my sleep is extremely interrupted. And then the other thing is, I don't go on walks. So when the family go on walks, I just don't go, because we went to the Virgin Islands a couple of years ago, and it was just so miserable the whole time that I finally ended up giving up going on walks. So I can go a half a mile or a mile and then I'm done, and then they go enjoy themselves.
Or you jump on the bicycle.
Yeah, so I can also follow them on a bicycle if it, when we're out in Puerto Rico or something. Obviously, we don't have bikes with us, but here around the neighborhood, the family will go on bike rides, and I follow, or they'll go on walks, and I'll follow on my bike, and so I have to kind of circle around them the whole time.
Yeah. So biggest symptoms are terrible sleep quality, and
Yeah.
then just pain, numbness, lack of mobility.
Yeah, and I would say that, like the other guy said, the pool guy on YouTube, he said that it wasn't as much the pain, which the pain is there, and it does remind me not to do things, but I've been kind of guarding my back for 5 years at least.
Yeah.
So I don't bend over anymore, because once I have no disc at all left. So once it pops, the pops is just terrible, the pain. But it doesn't hurt unless it really pops. There's always a dull ache, but the pain's not excruciating. It's the numbness. It's so weird and bizarre feeling.
Yeah.
And the numbness now on my left leg, lower leg, it's painful. Yeah. So I can't, like if I go for a massage, I just tell them to leave off my calf, which used to be enjoyable, but now it hurts so much to touch it that I just don't want anybody to touch it.
Yeah. So then what are you looking forward to, and what are you not looking forward to for the surgery?
I'm an ER doctor, so the only thing I see are the catastrophes. And so failed back, the obvious things, any kind of surgery, you're never as good as the way God made you to begin with, for the most part. This is going to be a permanent restriction in certain activities. But the more I think about it is, number one, I'm young enough to enjoy if I do improve. And I was talking to another friend of mine who's another ER physician, and he had the same thing, but his was L5S1, a Pars defect. And he was a bodybuilder and jiu-jitsu guy, and he still does a great deal of things. But going into the surgery, he was like, if I'm 50% better, I'll be happy with that. Mm-hmm. So if I could turn back the clock 5 years, I would be happy. And then it's on me, I think, to prevent the quick progression to adjacent disc disease.
Yeah.
So I think if I guard my back like I've guarded my back really more than 5 years, I think I can certainly delay it, if not prevent it. Having to fuse another segment or herniating a disc above it. I won't have a disc below, because the plan at this point is a 2-level fusion. So I'll have L3, L4 to worry about next. But I've already been guarding myself for years. And so I think it's part of my routine, and because I've known something was wrong. I didn't get the diagnosis until 2012. So yeah. When I was in Afghanistan the first time is when I got the diagnosis. At the end of that deployment, I was like, yeah, something's not right. And one of my best friends is an orthopedic surgeon. He did flexion extension views on me. He's like, you got a Pars defect, that's your problem. But at the time, it just wasn't anywhere near, the symptoms weren't bad enough to do anything about it at that time.
Yeah. And then what's the recovery looking like, according to what you've heard?
4 to 6 weeks of no driving. And I don't know exactly if it's so many questions I don't know, because you don't spend a ton of time with your surgical team pre-op. So today will be my first real extended period with them.
Yeah.
And I have a close friend that's a back surgeon, but now they don't live here, so we don't talk all the time. So I'm thinking, I think that the driving restriction is more because I'm going to be on pain medicine.
Yeah.
But some of it is you just can't take the chance of disrupting this hardware.
Yeah.
So I think at least 4 weeks non-driving, which won't be hard for me, as long as I have somebody to go to Wanda Coffee and get my dirty chais, I'll be good to go. If I have YouTube and dirty chais, I'm fine. And and then of course, boating. We went boating Saturday. completely miserable. The wind speed was only 7, so normally it doesn't jerk you as much, but we had a couple of kind of big hit waves that we ran into, and I was completely miserable yesterday. And so I think that my boating and water activity for the rest of the summer, unfortunately, it's July, which the favorite month around here is September and October in the water.
Yeah.
So those will probably, I can get in the water, but I would be very hesitant to get on the boat just because the water can be rough enough to where it would disturb it. So I'm gonna do very little except for walking. My plan is really to walk and walk and walk as much as I can.
Yeah.
And enjoy being able to walk again, particularly with you guys around the neighborhood.
Yeah.
Force you to go walk.
That's fine.
You can run circles.
Yeah, I'd like that. So 4 to 6 weeks, no car, and then when do you think your first gym session can be?
I don't know. That hopefully I'll get back in with the physical therapy group that I really enjoy here. And I don't know who this surgeon uses. I picked this surgeon from a combination of things. Another physician friend had him do the surgery. The pain management doctor that I know very well that injected my wife's back recommended him, and our favorite physical therapist, who has since moved to got a job at a bigger company, she recommended him. So I'll go on her advice and then the advice of the PT group that they refer me to.
Cool. Anything that we're missing?
No, I'm dreading it, but I think it's to the point now where I'm ready to get it done, and I think I've got the right surgeon.
Yeah.
I think I've covered all the bases. He thought that I probably waited too long just because I had erosion of the end plates of my vertebra because the disc is gone. And so, the hope would be to taper off the narcotic pain medicine as quick as possible and then kind of get back to just enjoying being active again.
And then are we going to make a follow-up tonight, tomorrow morning?
Maybe. So what I plan on doing, if you guys, so we'll film post-op, just see what my pain is post-op, see if I can see my friend that we did our residencies together. He said that one of his feet was numb for a year, and he didn't think that would come back. And he kept wiggling his foot under the sheets post-op, and the nurse said, "What are you doing?" He said, "It feels so wild to have feeling in my foot back," because, we think the worst, that we're never going to get any of the sensation back. And I've got a little bit of a foot drop now. And he was so happy to have sensation in his foot, but he kept wiggling it and proving that he could feel it under the sheet. So it'll be interesting to see, do I have neuropathic pain because the nerve's coming back alive? Because my left lateral calf, that's been decades. So,
so we'll try to do a follow-up then, I guess within 24 hours, but hopefully sooner. Maybe as soon as you're kind of coherent enough to say something.
And then the other thing is, I have had trouble emptying my bladder completely, which I may or may not put this on the video. I won't put it in. So I got a digital rectal exam, which I haven't had in years, and it's kind of gone out of favor. Because the only time it helps is if you actually have a lesion you can palpate. And then I had my PSA rechecked and it went down. So in 4 years it's gone down instead of up. And it's like 0.49, which is very low for my age group. So I don't think, and he made the comment, a very experienced family practice doctor, that my prostate was small. So it's going to be interesting. If that improves, I'll include it in the video, because I'm not so sure it makes anatomical sense that I would have trouble emptying my bladder. I don't have trouble controlling, but I can't completely empty it. Almost every time in my stream is certainly weak. So it's going to be interesting to see if there's improvement in that. If there is improvement, I'll include it. If not, that's a prostate discussion. Maybe I'll have it in a different video.
Cool. And then Yeah, maybe follow up a week and then just kind of play by ear after
Yeah, so I'll do tomorrow, maybe going home video.
Yeah.
Hopefully day after tomorrow. And it's interesting because the pre-op process is just so bizarre that I spend much more time on my patients that have the flu than I've spent with my surgeon that's going to open my back up today.
Yeah.
I just think it's kind of opposite of what you would think. So the first nurse that called pre-op said that I was an outpatient surgery. And then the second one said I'm an inpatient. So meaning am I going home the same day or am I spending the night? So apparently I am spending the night. And I think since I'm a late start time, so my report time's noon. So I'm thinking my cut time is 2 p.m. So I think since I'm that late in the day for this big of a surgery, I'll certainly be an inpatient.
Yeah.
Which I was kind of excited thinking about being an outpatient, but I know Mom would prefer me be an inpatient for the night.
And then also, yeah, that's it. No, that's it.
That's it?
Yep. Good to go?
Yep.
All right.